Yeah. Sajjan sir, you can. Yeah.
Yes. A very good afternoon, one and all. On behalf of Ayurvedic Proctology Association, I, Dr. Sachin Patil, warmly welcome you all on this webinar on constipation. This is our third lecture. We have two distinguished speakers today. One is Dr.
सर आवाज गेलाय तुमचा, म्यूट झालात सर. सर चेक करा.
Dr. Sachin.
Is it okay now?
Yeah, yes. You're audible.
Yes. So on behalf of Ayurvedic Proctology Association, I welcome you all. We are conducting a webinar on constipation. This is our third day. We have two distinguished speakers. One is Dr. Upendra Dixit and second one is Dr. Harish Patankar with us today. I'll introduce Dr. Upendra Dixit first, who will be the first speaker of the session. Dr. Dixit sir has done his post-graduation in Ayurveda. He is a chief consultant at Dixit Ayurveda, Goa. He is an honorary Ayurvedic super specialty consultant at Divya Ayurveda and Nature Cure Center, Goa. He is presently working as member of Higher Educational Committee for implementation of new educational policy appointed by Government of Goa. He has vast experience, almost about 24 years as a UG and 10 years as a PG teacher with teaching in Chikitsa Samhita. He has worked as a member of Board of Studies for Ayurveda at Goa University for 14 years. He has a vast clinical experience as well. He is working as a physician for 25 years at Ponda, Goa. He has achieved many awards and published many articles which are beyond the scope of this particular introduction. So he will be talking on Malavshtambh, AyurvedicChikitsa and Panchakarma. I welcome you, Dr. Upendra Dixit, and hand over the screen to you. Thank you.
Okay. Thank you for the introduction. Good afternoon. My today's topic is Malavshtambh or Malavibandha and its Ayurvedic treatment. If you will just look at the Bruhatrayee, that means Charak Samhita, Sushruta Samhita, and Ashtang Sangrah and Hriday, about the abnormalities related to stools, Purish. There are around 450 entries in Lakshan Kosh, published by Tilak Maharashtra Vidyapith, Pune. And in that, we find about Malavibandha, that means we can roughly translate as constipation. Around 40 important references are available about that. Now, if you will look at these references, actually, if you will go by the actual texts, then these references are very important clinically also, because we roughly use the word constipation, but the text they use specific words like Purishasya Gadhatvam, and then it indicates Vata Vruddhi or Raktarsha. If it is Purishasya Alpa Pravrutti, then it is indicative of Vataja Arsha. If it is Malavibandha, then it is indicative of Ajirana, Pravahika, etc. If it is Purisha Sangha, then there are a lot of conditions associated with that, including Udavarta, Vataja Gulma, Vegavarod of Adovat and Purish, Adman, Samadosh, etc. So by using specific word, we are able to reach a specific diagnosis and there will be specific treatment done. So although a person who is making in general his practice, he initially may find it difficult, but with little practice, he can master even these things and reach to a specific diagnosis, and therefore the treatment will be very specific and therefore highly effective. For example, many patients, they complain that they get the sensation of defecation, that means Malavega, but when they actually try to pass the stools, then they are not getting the malaveg. So that means this condition is related to gulma as per the text. Therefore, these things are very important to note. Then we can reach to specific diagnosis. So which are the commonest diseases which are linked with constipation according to Ayurveda? There are ajirna, vata vriddhi, gulma, grahani, udavarta, prameha even is mentioned, and vataja pandu is associated with malavibandhak, purish vegavarod, and purishavrit vat. And each one of them is having specific presentation. Like purishavrit vat, in that it is said that chirat pidita mannena dukkham shushkam shakrut sujit, that after eating the food and with great difficulty hard stools the person passes, like that. This is very important because in many patients, ajirna or indigestion is the most important cause, and that's why the stools are not formed properly, and that's why they are not evacuated properly. That's why this description is very important. Also, we can note vataja pandu. Unless we treat the underlying condition, unless we treat vataja pandu, the relief which the person will get in constipation will be temporary. If we treat vataja pandu, then only he will get cured as such. Or prameha. In prameha also hard stools the person may have, or depending upon the type of prameha, but vibandha he can have. And then when prameha is treated, then specifically the person will be cured from his disease. So in general, when we think of constipation from Ayurvedic perspective, then first of all we will have to understand that there are abnormalities related to utpatti of purish, and then there are abnormalities related to pravartan of purish. It means formation of stools and then evacuation of stools. So like that, in two groups we can understand the abnormalities. And then the abnormalities related to formation of stools, in that the digestion, and from that the kitta ansh which is formed, that needs to be understood, because if that is not properly formed, then the stools will not be properly formed, and then there will be vibandha. Then it is told that undukastam vibhajate malam maladhara kala. So at unduk it is told that the kittansh is divided into ghana and drava part, and from that stools are formed. Now in this process various factors are involved, like in ghana drava mala pruthakkaran saman vayu is mainly involved along with agni, and in pachan there are a lot of other factors involved like prana and saman vayu, pachak pitta is involved, and bodhak kaph and bodhak kaph is involved in that. So these factors, so we will have to take into consideration these factors, whether which of these factors is not functioning properly, and that's why the person is having vibandha. Like that we will have to think. Remember that majority patients who come to us, they have constipation because they are not having proper digestion, and because the digestion is not proper, the kittansh which is formed, it is sama, it is containing ama, and that's why the purish which is formed, it is also sama, and this ama is having a tendency to stick inside because ama is having pichil guna, so it sticks inside, and therefore the person is not able to defecate properly, therefore it is not going out properly. If only the person takes purgatives, or if the person makes force, then temporarily some relief may be obtained. But what will happen that due to this process, vat prakop may take place or raksha may be produced, and therefore sometimes this pichil guna of am may get converted into styan guna, and therefore it will become more and more difficult to treat that constipation later on. Therefore, we have to understand that majority of the patients they take food late in the night and go to bed after that, or they are not given proper time for digestion, and after, because the digestion was not proper, that's why digestion is not completed by the next morning, that's why the stools are not well formed, and because there is ama, there is stickiness, and that's why the stools are not passed properly, and the person makes force and worsens the condition, and this condition goes on. So therefore, instead of just giving the purgatives or medicines for passing the stools, we have to treat the underlying condition. That is, we have to improve the digestion. That is very important. When digestion is corrected, then constipation will be also treated properly. Then the stools will be formed properly, and then they will be evacuated properly. So this is very important to understand. Otherwise, what happens? I'm not making comment on any specific product or any specific company, but कायम चूर्ण तो कायम ही लेना पड़ता है, फिर उस जिंदगी भर लेता रहता है वो आदमी, because digestion is not improved and he is taking just some medicine which will help in passing the stools. Now, when we talk about the pravartan of purish, that means evacuation of the bowels, then apan vayu, as we know, it is linked with that. And but apan vayu is also linked with other factors like purish, mutra, shukra, artava, garva, nishkraman. All these factors are linked with apan. Therefore, they are interlinked, and therefore, in conditions related to mutra, like Vatasthila and Mutra Jathar also, the text described Purish Vibandha. Therefore, when Mutra Pravartan is not proper, that may in turn affect Mala Pravartan also. Same way, Artha Pravartan may affect Pravartan of Purish and vice versa. And Garbha Nishkraman. Therefore, Garbhini also get Vibandha sometimes there. And Shukra also. So there are some people who are performing Ati Vyavaya or Ati Astamaitun or something like that. And because of that also Apan Vikruti takes place, and therefore indirectly there is effect on Mala Pravartan. This is also practically observed. And in such patients, we cannot just give medicines which will evacuate the bowels, but we'll have to treat the underlying condition, therefore. So in such conditions, we'll have to treat the patients by giving medicines like Shatavari, Ashtimodhu. And in first chapter of Sutrasthan, it is told that Dugdha is very good for Vibandha of Purish, so that we can make the use of that in this condition. We'll have to take into consideration which factors they produce the Purish ultimately. So the Kittansh from Ahara, then Ghanamala from all over the Dhatus, then part of Udak is also getting converted. It is combining with Purish. Then Pachak, Ansh of Pachak Pitta comes, and therefore in Ruddapata Kamala, Purish Ranjan does not take place, and whitish Tilapishtanibha stools are formed. And Sneha Ansh from Majja is also coming and joining the Purish, and that's why the Purish is formed. So this is also very important when we treat constipation from Ayurvedic perspective. Which of these factors is not formed properly, which is abnormal, accordingly we'll have to treat. For example, if Udakansh is not proper, the person is not taking proper drinking water properly, then that needs to be corrected, or the fluid intake needs to be corrected, and then constipation can be treated. Pachak Pitta, if it is not functioning properly, then that way it should be treated. For that purpose, there are various medicines which will help in that, like Arogyavardhini, Tamra. They are performing Bhedan of Pitta, and then that Pitta will come to the Purish, and because of that Sara Guna of Pitta, stools will be properly evacuated. Tamra, Kumari, Katuka, such kind of medicines. Then Phalatrikadikwath, or it is available in the market in the name of Vaza Uduchadikwath from South Indian pharmacies. That can be used for this purpose, or Patola Katuru Hendadikwath, that can be used for this purpose. Now Majja contributes to Purish by its Sneha Ansh. A Sneha from Majja is coming to Purish. And because that is not coming, sometimes the stools are hard, and that's why they are not passed properly. This is also observed in many patients, usually who are performing Ati Chintan, thinking, like researchers, scientists, computer workers, teachers, etc. In them, this kind of condition we find, or due to some other reasons, Majja Kshay is taking place. Then also we can observe this. And in these patients, when we give them medicines like Jatamausi or Brahmi or Shankhapushpi, then they get very good relief. And usually we are giving the medicine, this Jatamausi we are giving at the night time. So people think that this is the medicine for evacuating the bowels, and therefore they tell that आपने जो वो संडास वाली दवा दी थी वो बहुत अच्छी है. तो हम लोग बोलते हैं अरे जटामाउसी का ऐसा अपमान मत करो, उसको संडास वाली दवा बोल रहे हो तुम. So they think that it is for that. But by taking Jatamausi, their stool habits are corrected because Vata Shaman takes place, Majja works properly, and that's why the Snehansh in the stools is improved, and the control over Gati of Vat is obtained, and that's why even the constipation gets corrected with that. And Brahmi, of course, it is having Saraguna. The Brahmi will be even better if Pitta dominance is there, and we use Brahmi, then it will be a better choice. Shankha Pushpi is used in when Vat dominance is there, Dhatukshajanya Vat is there, then it is used. So even under Medhya Dravya, we have to make a choice. Now, in the patients having constipation, we have to find out what is his diet, and therefore which are the factors which are leading to this constipation. So Hetu, and even while treating, we have to understand the effects of rasa on that. So you can see that Amlaras performs anuloman. This is very important, and because it will help in proper evacuation of the stools. Lavan rasa stamba sangata bandha vidmapana karoti and margan vishodeti. So therefore, for removing vibandha, Lavan rasa is very important. When it is properly used, vibandha will be removed. Katuras margan vishodeti bandhan chinatti. So at proper use of katuras, because katuras excessively used can cause vibandha. Tiktaras is purisha shoshana, so tiktaras can cause vibandha as such. And kashaya rasa stammana atiyogat purisham avagruhnati. Purish avrod malavibandha can be caused by kashaya rasa. And there are some certain patients. For example, one patient who was coming to me, he was having malavibandha as well as his quantity of urine was also getting reduced day by day. And there were other things. There was dryness of the skin because sweating was also very less. And he was also having weakness and all. Then when properly inquired, we found that he was taking karela, that vegetable, daily, because he thought that he will prevent diabetes by taking that. So although he was a thin person and a weak person, but he was taking atiyoga tiktaras, and therefore he developed this kind of condition because tiktaras performs shoshan of purish. Therefore this needs to be understood, the effects of rasa, and accordingly we have to treat. Therefore Ashtang Sangraha has told that tikta, katu and kashayaras, they are ruksha, and usually they result into baddha vind mutra maruta. Purish, mutra and adhovat, their vibandha is caused by tikta, katu and kashayaras. So if the person is using them, that may be a major factor, and that is causing the malavibandha, and that we need to understand. Whereas lavan amla madhura, they are snigdha and srushta vind mutra maruta. So that also we have to understand. So by taking lavan amla and madhur ras, the evacuation of the stools will be facilitated. So for that purpose, various medicines we can use, or food articles we can use. For example, grapes or draksha or kismis can be used, which is having madhur ras and which will help in proper evacuation in the form of madhur ras. Even when yashti madhu is used in apankal, then that helps in proper evacuation of stools in patients having shukrakshay or majja kshay, and that's where raukshay is produced. Or when already tikta, katu and kashayaras the patient has used in excessive quantity, then also this happens. Therefore yashti madhu using in apankal is another important thing. And lavan, proper use of lavan, that is saindhav, usually we will use, or other types of lavan are also helpful. So we'll have to go in details of the actions of each lavan on the body. For that purpose, to choose which particular lavan, but commonly you can choose saindhav. So when that is used, then malavibandha also can be removed. Now we have to understand that what is the exactly problem. So if the digestion is not proper or the formation of the stools is not proper, then we will have to act through samanvayu, because actions of samanvayu are not proper in that condition. And then we have got a very good advantage in Ayurveda, that aushadh sevan kala. Therefore, if you are using the medicines for constipation at night, then you are just imitating the modern medicine, because their medicines, they are intending that at a particular time the medicine will show its actions. So after taking the medicine, after how many hours the medicine is going to show its actions. That's why it is taken at the bedtime, so that early morning when he wakes up, immediately he will get motions. With that calculation, it is given. But if you are giving Ayurvedic medicines, remember that we have got Aushadh Sevan Kal, and they are very important, and it makes huge difference when you give medicine at bedtime and when you give medicine at Saman Kal or Apan Kal. Therefore, if you are using at night time, then now try this way, and you see there will be a lot of change, a lot of good results will be observed. So if the digestion is not proper or the formation of the stools is not proper, then give medicine in Samankal, that is in between the meals. So if you will give medicine in that way, that means you can tell the patient that take the medicine in your thali, and after having half of the meals, you take this medicine with a bolus of the food, and then continue your further meals. That will make huge difference in the results. And if the evacuation of the purish, that means pravardhan of purish, that is the abnormality, then apankal, that is before food. So the same medicine which you are giving at night time, divide in 2 doses and give in apankal twice before the meals, and see the difference in the results. Now again, understanding the concept of anuloman, srausan, bhedan and rechan is also very important. Just taking any particular specific combination available in the market and giving is not a wise thing. We have to understand that what is the underlying abnormality, and accordingly whether anuloman we need to give, or srausan we need to give, or bhedan or rechan. And accordingly, if you will give the medicines, then the results will be better. So this also we need to understand, but I'm not going in details of that right now, because that will take a lot of time. Now we will turn to some commonly used medicines. That means commonly means there are a lot of medicines which various Vaidyas are using in their practice. But I am telling you some of the common medicines which I have used in these climatic conditions in Goa. Which medicines I have used, that I am telling. So that's why if now the next lecture, if Patankar sir, he tells some other medicines, don't think that how this is, there is a difference, because he is practicing in a different condition. And of course, what kind of patients Vaidya is getting, and therefore what the Vaidya needs, accordingly he chooses. So now see, Avipattikar Churna, it is a main ingredient is Trivrut, and it is told that Trivrut Sukha Virechananam. That's why if we want that kind of action, Sukha Virechan, mild action it is having, but in Pitta Pradhan conditions, it is very useful. So if that kind of action we want, we can use it. Just one incident I will tell. One lady, long back when I started my practice newly, that time she came and she told that my son is having habitual constipation, and tomorrow he is having important interview, and you give some medicine by which he will be having proper evacuation of boils, and he will be feeling healthy to appear for that interview, and he will be getting selected in the physical tests also. So I told that, okay, take this medicine and give it to him right now. Last night she had come to me. So she said that no, he is coming from Mumbai to Goa, and morning he will reach, and immediately he will take the medicine, and immediately he has to go for the interview. So now what to do? Because immediately if we want to give the medicine, then it should be that strong that it should act instantaneously. But if it is so much strong, and suppose he gets loose motions, then also that lady will blame us. Otherwise, if we will give mild medicine, then also she will blame us that it didn't work. So I thought that Avipattikar Churna, it is not going to give any trouble. So Avipattikar Churna in a little larger dose I gave to him, and he had good motions, and his interview was good. So just an example. Now Gandharva Haritaki, as you know, Haritaki and Erenda Tail, it is Bharjit in Erenda Tail, and this is used in Vata Pradhan conditions mainly, or Vata Kapha Pradhan Avastha. So like that we have to think. Shivakshar Pachan is a very good combination prepared by Vaidyaraj Yadavji Trikamji Acharya. And in that, as you know, Haritaki, Hingvashtaka and Sajjikshar, they are used in combination. So in this Pachan takes place, and Anuloman also takes place. And when Sajjikshar is added, Pitta Vruddhi will not take place, or if Utklesha of Pitta, even if it takes place, then with Bhedan action of that Kshar, it will be moved out. So without any trouble, the person will have only the desired actions. So we need not go in minute details of the condition, but in general we can use. So for that purpose, he had prepared this combination. Just Triphala and Saindhav also can be sufficient in many patients. Or in children, just Amalaki and Saindhav are very helpful. that if Amalaki and Saindhav are given just before meals twice in Apankal, then it helps a lot in small children or even in infants when we want to give the medicine. This is a very good choice because for them this much is sufficient and very effective. And even though it is very tasty also, when we make this combination, you might have tasted already. If not, you can taste, and it is very tasty. So children will also take it very easily, and it will help a lot because of Saindhav, Stambha Sangata Bandha Vidmapan. So immediately the obstruction to the stools is removed, and with Amalaki Anuloman takes place. And both these medicines, they are having effects like Vrusha, etc. So even the bala will be maintained. Now in tradition of Vaidyaraj Joshi from Pune, Triphala and Katuka, this kind of combination is used. Then the effects of Katuka, we fear that it will cause trouble in the stomach. That is not happening. And Yadavji Trikamji Acharya, he told that by adding Sajjikshar, so instead of Sajjikshar, these days we are using soda bicarb. Natural Sajjikshar is not easily available to us. So when this combination is made, then the Katuka, its actions, gripping pain in the abdomen and loose motions, that kind of action is not happening, but proper evacuation of bowels takes place when this combination is made. Chincha Lavantel, as you know, is and Triphala Katuka and Sajjikshar is a drug of choice when the patient is having Amla Pitta or related to Sama Pitta conditions, Pachan and Bhedan of Pitta, like that actions are observed. Chincha Lavantel was used by Vaidyaraj Datar Shastri, and in very hard stools, and when Snigdha Guna is less, and that's why it is happening, then it is a Snigdha Guna and Anuloman, and in that he used to have groundnut oil, and that's why he told that it is parthiv in nature, and that's why it helps better. Eranda tail is very important, and Eranda is that way having a lot of good actions on the body, like Vrusha. It is described as Yoni Shukra Vishodhan. It is Medha Kanti Balaprada. Like that, actions are there, and it also helps in Rudrok, Prushta Shul, Katigraha, Guhya Shul. So that's means Shul. In Shul also it is going to help. So Erandatel is good choice in many conditions, and it is Snigdha but Amapachan. That's why it is a very good medicine. And soft gel capsules of that are available in the market. You may be knowing one of them, which I am using. I have quoted here. There are other companies also preparing. Aragvad is a type of Srausan, and when we need that, then we can use. And Aragvad in Charak Samhita itself, it is described that Aragvad is for the patients who are very delicate, or they are children or infants, children, then they are suppose aged patients or who are weak patients. For them, Aragvad is very helpful, and Aragvad is Mrudu, Madhur, and Shita. It is. And it is Madhur Rasatmak, so that's why it is Balya also. So it is used in conditions like Jwar, Rudrog, heart. So there we don't want to give something medicine which will be very strong and that may cause trouble to the patient. So there Aragvad is a choice. In Vata Rakta, without increasing Pitta or without performing Rakta Dushti, it is performing its actions. A lot of other medicines are there, like depending upon the underlying condition, like Phalatrikadi Vasaguduchadi, already I have mentioned, and Arogya Vardhini, because it is containing Katuka and other medicines. It is a very good medicine which performs Pachan, and it not only performs Pachan at Jatragni level, but it performs Pachan at the level of various Dhatwagnis ranging from Rasa to Med. And that's why it is very important. And if you want to learn details on Arogya Vardhini, Vaidyaraj Khadiwale, he had written a book on that, Arogya Vardhini Tantra and Mantra, a special book he wrote on the effects of Arogya Vardhini and how to use it. And of course, most of the Vaidyas, they are already using it. If we want to use, we want Snigdha Guna, then Triphala Kruta is very important. Then Arishta Kalpana, Abhayarishta is there, and Bhrungarajasa is very important because it is mentioned in the GHANASHYAM Adhikara actually. Therefore, it is not just helping evacuation of boils, but by improving proper evacuation of mala, by improving proper absorption of saransh, it is helpful in Rajashma also, so it is giving bala to dhatus. So that's why it is important. Now, in many patients, krimi are associated with malavibandha. It may be vice versa, that either krimi are there and that's why the patient is having vibandha, or the patient was having Nibandha, and that's why mala are getting accumulated in the body for a longer time, and that's why krumi are produced. It may be anyway, but in majority of the patients, specifically when the patients they get malaveg after foods, then that may be indicative of grahani dorbalya also, but it may be very important symptom of krimi also. Immediately after having food, the patient starts getting bloating of abdomen, gases, and again in gulma, like that it is mentioned in krumi also, that way it can be observed that the person feels that as if he has to pass the stools, but he's not able to evacuate the bowels properly when he goes for defecation. So in such conditions, all these conditions, and he's having crave for certain things like jaggery, good or oily things, especially it is very typical things are observed that the patients tell that only in the evening I get the strong desire to eat outside food which is oily or like that, and otherwise I can't stay at home. I'm getting irritated if I'm not getting that food. Likewise, there is a list of various observations from which we can understand that the patient, yes, he is definitely having krimi. And if it is there, then krimi kuthar or krimi mudgar like medicines, they can be used. And they are very effective if they are of good quality. They are very effective when the modern, we are getting many patients who have taken modern medicines for worms, but they have not worked, and immediately when we give krumi kuthar, it works. It is such a good medicine, but it should be of good quality. So even that is given, then immediately effects are observed and immediately the problems related to that are solved. The difference, I'm not going into details of the difference when to use krumi kuthar and when to use krumi mudgar, because it will take again a lot of time. Usually it is given with the combination of kampillak because it is tikshna rechan, and the krumis are having the tendency to stick inside. They will not be ready to easily die. They try to stick inside. They try to move to some other track in the body. Therefore, kampillak, it is having such strong action that it will not allow the krimi to stick inside. It will forcefully take them downwards and move them out. So that's why krumi kuthar usually in combination of kampillak it is used. So some important medicines I told you which can be commonly used, and again panchakarma, various panchakarma are very important. I have just mentioned 3 of them here because we have got a short span of time to explain this. That's why only 3 examples I have given. Basti, everyone knows about that. Varti is very important for instant results. When the patient is having constipation and is having a lot of trouble and he has not passed motion, suppose for 2-3 days or more days, we get a variety of patients of constipation, as you all know. I got one patient, he will not get the sensation of stools, and after 1 month he will get admitted in the hospital and the doctors will pull out that stools outside, and then only his bowels will be evacuated only once in a month. There were many patients, I got some patients who told that only once in a week they pass the stools. And when I gave medicine for some other problem, and I told them that by taking this medicine, your bowel habits will be also regular and they will daily get stools. Then they said, no, please, I will stop the medicines. Don't give the medicines. Only once in a week is okay. Who will spend so much time daily? Like Dr. that also patients are there.
Dr.
So,
sorry for interrupting you. We have few minutes left.
I'm concluding. Yeah.
Thank you.
So Varti is therefore very important in such patients. When we use Varti, then instantaneously the bowels are evacuated. And Navi Purana is another important method used, especially in the parampara of Vaidyaraj Nanal. And in that, what we are using is Hingu Triguna Tel, mainly we are using, which is available in the market. Sometimes we add Amalaki Tel to it, and that is added in the umbilicus of the patient, and around the umbilicus little massages are done. Then with that, it helps in passing stools or passing gases, and the patient gets good relief. So this is also one method which can be very easily used. So I think in the year 2020, we have to do the things in a very short time. So we have in a very short time taken a review of the highlights of Chikitsa of Malavibandha from Ayurvedic perspective. So I thank the organizers for giving me an opportunity to express my views on this topic. And Thank you all the listeners very much for their cooperation, and thank you very much.
Thank you, Dixit sir. So may I take questions right now or later on?
Yeah, if there are any questions for Dr. Dixit, we will take right now, I think.
Okay, okay.
Yeah.
So we have only one question, Dixit sir. It's for you. This is Dr. Thakar, I think. He has asked, what is the normal frequency of defecation? What should be the normal frequency of defecation in adults?
As per Ayurveda, twice in a day is mentioned in some texts. So twice in a day will be normal, but it depends on the person. See, a Pitta Prakriti person, usually he passes the motions more times in a day. Like that, according to the Prakriti of the person and his food habits, it will change. And the person should not stick to a particular concept that only once or twice only I have to pass the motions, because I got some patients that they were suppressing the urge, because they told that no, passing the stools once in a day is normal. So if I'm getting urge again, I'm suppressing it, and that's why they got the problem. So every person will have having a difference, but usually twice in a day will be all right.
Okay, okay. That's all from chat box. If anybody has still any questions for Dr. Dixit, can put it in chat box. Dixit sir, Patenkar sir, we are live on YouTube, Facebook, and Twitter as well, apart from Zoom platform.
Yes.
So we have next speaker is Dr. Harish Patenkar. He is MD Ayurved. He is a well-known Ayurveda practitioner in India as well as abroad. He is a founder and director of India's first ever Ayurvedic hair testing lab and research center, Kesha Ayurveda, which has 108 centers all over the world. It's a proud thing, Dr. Harish. He is a chief consultant at AyurvedicChikitsa, Pune. He has authored one book, namely Dravyagun Vishesha Vigyan. He has coined one concept named Smruti Ayurveda. That's again very good thing. He is a renowned physician and founder of Prachin Sanhita Gurukul. So the topic of today's talk will be thought behind using herbal preparations as far as Malavshtambh is concerned. So we welcome you, Dr. Harish, and platform is yours. Patenkar sir, you can share your screen. Sir, you are not audible.
Hello.
Yeah, Harish, you
Yes,
are
sir.
audible. Please start.
Okay.
Make it full screen.
Just a minute. Audio is okay?
Yes, sir. Absolutely.
Yeah, audio
okay.
is excellent. Your audio and video are both good. Only you have to make the presentation full screen.
Okay, welcome all, and thank you, Dixit sir, for such a nice and wonderful lecture. And yes, sometimes something happens for a good cause also. Due to your lecture, all the basic concepts are already cleared from here, from your lecture. So it will be, I think, a little bit become more easy for me to take some next things to the audience. Okay, so my all dear participants, can you see the next slide on screen?
Sir, it's only first slides.
First slide and not on full screen.
You can make it full screen.
Uh, Actually, I have made, but that is not happening from here. Okay.
All right. I think this is also this will work. So please go ahead, Dr. Harish.
Okay, no problem, sir. Thank you very much. So thank you, sir. And I will start my today's topic, the thought behind using the herb preparations, AyurvedicChikitsa, under the Proctology Association today. And thank you, Sangvi sir, and all the team of this for giving me this chance to present my views over here. So, as in Ayurveda stated, dosha dhatu mala moolam hi shariram. So we have to understand first what is the mala. Okay. So whenever so dosha dhatu mala moolam hi shariram. So let's understand the mala first. I always says in my lecture, real beauty is hidden in malaha. So we have to, if we want to become a beautiful, or if we want to make our body beautiful, then we have to make our mala beautiful. I think this will be the different concept to listen, but I'm sure you will be agree with me after 2 minutes, because we are planning the Swachh Bharat Abhiyan. We are trying to clean all our home. We want to, if we want to make our home beautiful, we have to do the proper cleaning of our home. If we want to make our nation beautiful, then also we need to clean our nation. So cleaning and making mala beautiful is the key to become a beautiful. So I think you all of you are now agree with me that real I think now all of you are agree with me that real beauty is hidden in malaha. So let's see here. If according to Ayurveda, this one slide, yeah. If according to Ayurveda, dosha plus dhatu plus mala is equal to sharir, it means dosh, dhatu and mala are the structural and functional unit of our Ayurvedic Kriya Sharir. In modern science, cell is the structural and functional unit of our body. So in short, sharir is equal to body and cell is equal to dosh plus dhatu plus mala. So if we see here unhealthy cell versus healthy cell, you will find out here in unhealthy cell, only some part of nutrition is absorbed and only some waste products will get out of the cell. That's why that cell will get disturbed and it will lose his proper life. The same way, in healthy cell, a good nutrients can be get absorbed and a waste product will be also good and it will be evacuated from the cell very nicely. That's why the life of the cell will be good. As it happens at cellular level, the same thing happen at the systemic level also. That's why I'm trying to give you or want to revive this concept once again. Cell is the structural and functional unit of our body, and that's why dosh dhatu mala is the structural and functional unit of Ayurvedic Kriya Sharira. That means cell is equal to dosh plus dhatu plus mal. So if we want to make body clean or nirmala, that we say always in Marathi also, we have to make our mind as well as body nirmala. Next slide, please. So if we want to make our body nirmala, then we have to make it free from armor. So how can creates the problem in digestive? As all of we know, when there is undigested food in our body, it automatically starts different problems like and roga sarvepi mandegne, we all know, and that basically is the starting point for the um, constipation, we can say. So in modern science also there are different types of constipation: obstructive constipation, or spastic constipation, or we can say when we lost the, lack of the muscle tone, due to that you will find the constipation. Next slide please. So like this, if we go through a little bit also leaky gut syndrome or the concept, I'm trying to just correlate you or want to just trigger you on this concept about the how armor gets absorbed into the body with this leaky gut syndrome, and due to that absorption of that arm or any pathogens or anything whatever will be there, which will get absorbed into the body, and those all will cause the problem. So we have a skin problems, we have a liver problem, heart problems, a problem from brain to anus, we can say. All problem starts from the gut. It's like a mind gut relationship also, and irritable bowel syndrome like problems also we find from this. So why this is happening? Okay, next slide please. So as we have seen, all these type of digestion, if there is a good digestion, as our Dixit sir have told us very nicely how it happens: purish, snehamsha, dravamsha, snigdhamsha. With that only there is a Bristol stool chart also. Okay, if we try to correlate with the modern science also, I'm just trying to little bit collaborate this concept to get more clear. So you will find the type 1, type 2, type 3 like this. Okay, next slide please. Yeah. So in modern science also, for all these type of constipation, you will find the different types of laxatives, bulk forming laxatives or osmotic or a different stimulant. Okay, you know this concept very well. My today's topic is Ek Dravya Chikitsa. But before starting the Ek Dravya Chikitsa, I want to just click these things, because that will make our idea more clear with Ayurvedic perspective also. Next slide, please, sir. So you know this modern view of treatment for the bulk forming type of laxatives, for lubricating laxatives or stool softeners or saline or stimulant. Next, please. And you know the generic name and brand names also. So we will see the Ayurvedic concept to treat such kind of constipations. Okay. So in Ayurveda, for example, now this is slok from my own Dravya Guna book. Okay, where we have made the classification of the drugs according to the Rasaviri Vipak. So Katu Katu Ushna group is here mentioned for the learning purpose only. Like this, there are 376 medicinal plants in Ek Dravya Chikitsa, which we can use very nicely for the Ek Dravya Chikitsa of constipation, or we can say like this, for any kind of Ek Dravya Chikitsa. So just overlook this concept. Chitrakam ardrakam danti maricham krishna jirakaha vidangam shatava hingu raseshu katukatmaka. So when this group come first in our mind, or when we want to learn this group, how to learn the groups? For example, when we are in first year, our Juvekar sir always told us, when there is a Bhedaniyagan in Ayurveda, okay, there is a Bhedaniyagan in Ayurveda. Arka, Randa, Chitra, Chitrakachira, Bilva, Shankhi, Nisarla, Hemakshiri, Shishravani, Mukhi Vedani Yoga. When you are going to chant that Bhedaniyagan again and again, without medicine also the patient will get loose motions while chanting the Bhedaniyagan. This is the beauty of Ayurveda. So see the beauty of Ayurveda, learn the beauty of Ayurveda, enjoy the beauty of Ayurveda, and see these minute differences. So if you are in remote place and there is no medicine in your hand or no any drug in your hand, and till if you want to remove the constipation of the person, or you want to give there a mild laxity or very karya, So you can make that karya like Mani Mantra Aushadhinam Prabhava. You can do that work from the Prabhava also. And the chanting of shloka again and again. Arka, Randa, Chitra, Chitra, Kachira, Bilva, Shankhe, Nisarla. I think that chanting of the shloka by the Vaidya sitting in front of the patient will make a loose motion to the patient. So jokes apart from this, we will go one by one for the single drug also. Chitrak, Ardrak, Danti, Marich, Krishnajirak, Vidanga, Shatava, Hingu. This is the 8 classical drugs. So we will see one by one. Next, please. Okay. So now see the Chitrak, which you know, Plumbago Xylenica. It comes in Bhedaniya Gan. Look at there in Gana section also. Okay. So it is under the Bhedaniya Gan. So whenever there is a constipation and with a cruel koshta, we can say, or a koshta of kafaj person where we need the Ushnaras, Katuvipak and Katuras medicine, then there must be Chitrak as a first drug of choice in such cases, as like AyurvedicChikitsa. And if you want to give the kalpa, yes, then you have Chitrakadi Gutika, Chitraka Gruta, Chitrakavleha, or Chitrakwat, like this you can give. Now, if the patient with the Agnimandya comes in front of you, I will give you the 8 different study case studies like this. So if the patient with Agnimandya is coming to in your clinic for the treatment of constipation, the constipation is due to the Agnimandya now. In case of Chitrak, the constipation is due to his Krur Koshtha or Kafajadita Koshtha, Amaj Koshtha, like this. But in Ardrak, there is Agnimandya due to Agnimandya there is constipation. So we know Bhojanagre Sadapatyam Lavana Ardraka Bhakshakam. So you have to just eat the lavan and ardrak before food. So the Dipaniya Karya will be there, and after some days you will find there is a good laxative work also done. So see the beauty. When to use Chitrak, when to use Ardrak, Bhojanagre Sadapatyam Lavana Ardraka Bhakshakam. Then yes, definitely there must be a question in your mind. What about the Danti? So in Grantha, it is stated that Danti Rasadde Tullapi Chitrakasya Virechani. So if we do the comparative study in between the Chitrak and Danti, so Chitrak is also Kotukatu Vishna, Danti is also Kotukatu Ushna, but as compared to Chitrak, Danti is more Virechak. That's why sometimes Chitrak is told a little bit Grahi, but it is not actually actually Grahi. It is a Bhedaniya. It is what we can say. If there is a hard stool, then Chitrak can break that stool with his special peculiar property of Bhedaniya, and then the constipation, then it helps to remove the constipation. But vice versa, Danti is Rechak in nature, so you can prefer the Danti whenever you want to do a typical Virechana. That's why it comes under the gun of Virechana. Okay, so you can use the Danti Arishta or Danti Haritki like this. Next slide, please, sir. So I think now you are going to enjoying this type of learning. So in Marich, Krishna Jirak, Vidanga, Shatpushpa, Hingu, we will see one by one. Now, if there is a constipation due to the Krumi and Agnimandya, okay, looking into the 3rd number column. So if there is a Agnimandya plus Krumi, then you have to think for the Maricha. So you can give the Marichadi Tel, Marichadi Gutika or Maricha Gruta, and it will treat the constipation as well as it will remove the Krumi. So whenever you will find the patients with such type of constipations having the Krumij history or like tapeworm or anything you can say in type of worms, or Agnimandya is also there, then think for the Marich and the Kalpanas made by the Marich. Okay. The next patient, if patient came in front of you having Sukumara, Bala Avastha or Sadhya Prasuta also, okay, then you have to think for the Krishna Jiraka. Krishna Jirak also very nice Katu Ushna medicine, and which is very nicely given to such patients. That's why Tel and Arka Kalpana of Krishna Jirak is used for this. So, like Jirakadharishta or other medicines also for the Apana Anulomana. So you have to use the property of Apana Anulomana over here. Next drug is Vidanga. So whenever there is more krumi, kushtha, and you want a little bit tikshna, virechana, the Vidangarishta is very nice kalpa. Vidangavlehi is also nice kalpa. So you can use the Vidanga in such kind of kafaja, krumija constipation. Are you getting me? If there is a kafaj, krumij constipation, you can use the kalpa of Vidanga. The same way, the next medicine is Shatapushpa in Katukatu Ushna only. Okay, Shatapushpa. So Shatapushpa, that gripe water for babies we generally gives. Okay, it removes the gases and it gives a mild purgative effect. It's same. The Shatapushpa Churna Tail or Arka is always best for such babies from 0 age group. Okay, so you can use either gripe water or Arka of Shatapushpa. Okay, the next medicine, Hing also. Right now, Dr. Dixit sir also told that Nabi Puran and other Chikitsa. Whenever there is a constipation, always you have to think about the Hing also. Constipation with abdominal pain, Udarshul and constipation. Then Hingu does the excellent work. You can keep the Hingu Churna in Nabi also, or you can give the Hingvashtak Churna, Hingva Divati. Too many preparations are with the Hingu to treat the constipation. Next slide, please. So I think now you are getting how to understand a single shloka. So here Chitrakam Ardrakam Danti Maricham Krishna Jerakaha Vidangam Shatapushpa Hingur Seshu Katukatmaka. So from Katuras, Katuvipaka and Ushnavirya, 8 drugs, how to study accordingly for the constipation only, we have learned with a different angle. Okay, next slide, please, sir. Next one. Yes. So, which are the other drugs? Haritki, Bibitak, Amalki, Triphala, Kutki, Sonamukhi, Isabgol, Erandatel. Okay, you have learned a lot. There is a huge list of Ekdravya Chikitsa in Ayurveda for treating the constipation. But oftenly, we are not using this. Okay. So, my today's motive is to make our all Vaidyas or all the doctors to think about egg dravya for treating such type of constipation or malavibandha, we can say. Next slide, please. For example, I have tried to make you group, okay, to treat easily with the what we say with the blessings of our Mahesh Sanghvi sir. He motivated me to teach like this also. So I have made here a small systematic some collection of drugs for you. So for age group from 0 to 18 years or for Garbini, Sukumar or Bal, whenever there see in this all typical Sukumar patient, there is a always Kafanubandha. So use the Ushnavirya Dravya, but having the Katu or Madhur Vipak and mild Rechan property. So first drug of choice is always castor oil or Arundel Tel. Arundel Tel is very nice and best for such patients. From 0 age group you can use. So just make a lukewarm Arundel, put it into the nabi of the patient, that small baby, or make a small basti like what we can say a fold of papers and just insert it into the anus of that baby. That mala automatically gets out from the body. And this is the beauty of castor oil. So always try to use the arundel tail or castor oil in such from the 0 age group patients. It's always best. Shatava or body shape or shatapushpa, which we have learned over here, are like the baby gripe water products. So you can use in arka form. Ajmoda is also there. Ajmoda is also one of the excellent drug in 0 to 1 month, 2 month babies also. What you have to do, you have to give that ajmoda to mother to chew. So mother will chew the ajmoda, and when she will breathe out that smelly part of ajmoda to the mouth of the baby, that baby gives purgative action. Okay, or it is very nice to reduce the kapha from his body also. So these are the small techniques which we have to use. You can give a woman to the 0 to 6 month baby also. How woman is also urdhva virechana. So Jyotishmati, Yashtimadhu. Yashtimadhu also is one of the excellent drug. I have given woman to 2 days baby only. So you will be shocked. How can you give the woman to the 2 days age baby? So it is not like you have to give the Grutapan and you have to do the woman. Whatever the mucus is coming in his mouth, you have to just mix the Jatamamsi, Yashtimadhu with the honey, make one finger just insert in the mouth of baby, just clean the mouth, the cough will automatically comes out and just clean it. So sucking the cough is also a small woman, that is the Urdhva Virichan. Like this, with using the castor oil, you can do a Laghu Virichan of that baby also. So think the Ek Dravya use of Ekal Dravya use for such kind of baby or 0 to 18 years of age group. Next slide, please. So if we have a more age group from 18 to 35 years, then what is the condition there? As you all know, Bala, Tarun and Vruddha, three types. So Kapha, Pitta and Vata are automatically the dominance of doshas over there. So we have to use the drug accordingly. So in 18 to 35 years, there is always a Pittanubandha. So use the Shita Virya Dravya having Katu and Madhur Vipak with Rechak property. So Kutki, Kiratatikta, Aragvad, Yashtimadhu, Kumari, Amalaki must be the drug of choice. So if you don't have the single herb, then think for the Arogyavardhini contains 50% amount of Kutki. Bhunimbadi Kwat contains the Kiratatikta. So like this, you can think which kalpana can we can give for the patient. But we have to think for the Rasavirya Vipak and we have to select the drug for the excellent result, which is my today's take home message. If you want to give the excellent result to your client or patient, then you have to think about his age group for Rasavirya Vipak and the single herb property. Aragvada is over here. Aragvad Kapilavati also one of the best. Yashti Madhu is here. Yashti Madhu Ghanavati we give. Kumari also we give. Okay, or Amalki, you can give the Amalki Vati or Trifla also. Next slide, sir, please. So like this, as per the age group also, you can think for the drugs. Age group 35 to 65. Okay, or above, we can say 35 to 65. A little bit Koshtha Sthaulya is over there. So Ushnavirya and Madhur Vipak always works excellent. So Pipali, Patola, Haritaki, Bibitak, Drona Pushpi. Okay, these medicines must be your drug of choice, and this gives the excellent results. Gomutra Haritki or Bhallatak Haritki are also some another culps which you can use over here. Next slide, please, sir. Okay, and if there is a age group more than 65 and above, I know all of you must be facing more problems from this group. So try to avoid the Churna Kalpana in this group. Try to avoid the Churna Kalpana in this group. Give maximum Siddha Taila or Gruta Kalpana. Why I'm talking like this? Because as we have bifurcated the Kapha, Pitta and Vata age group, this is the typical Vata dominance age group. And for Vata, we know uh, Taila is best. You know? So if we want to do the Vata Shamana, then Taila or Snigdha Dravya is required there. So too many patients come now, they are taking Kayam Churna, they are taking Trifla Churna, and all aged people generally prefer the Churna Kalpana for making their bowel movements easily. But what happens ultimately after the 1 month, 2 month or 6 month of period using the powder or Churna medicine, the cost becomes more and more ruksha, and it becomes difficult for them to get the laxative effect from the Churna Kalpana. So for elderly, old age people, always use the Siddha Tail or Siddha Gruta Kalpana, and that gives excellent results. So you can use the Gandharva Haritki or castor oil with the milk or Aragvat Kapilavati or Sonamukhi with some oil and Gruta preparations. Okay, and you can use the Charakokta different formulations from Kalpasthan. Next slide, please. So actually, if we see how to study this type of dravya, there are 376 dravyas in our Dravya Gun. out of which 135 dravya are Vishesh Vanaspati and 241 Vanaspatis are Samanya Vanaspati. So whenever we want to use Ushnavirya or Shitvirya from Samanya or Vishesh Vanaspati, then this type of typical tabular format is must be in our mind. Which drug I can use for this particular patient? Okay, and that type of AyurvedicChikitsa or that type of study will help us to treat the each and every patient, because every patient is different, every patient is unique, and we have to treat each and every constipation case as an individual and different case. So don't try to use a same medicine for all the patients. Okay, next slide please, sir. So before ending, my last siddhant, which we can share over here, Pratyak Dravya, it is in Marathi. I will read in Marathi and then I will explain in Hindi or English. Swataha Mitra, Natlak, Kamgar or Malak, accept from their guna and dosha. If you are ready to try or accept any dravya which it with its guna and dosha, then you will be become able to treat the patients also by getting the knowledge of their prakriti and vikruti, by getting the knowledge of their sharirik and mansik bhav. Okay, some constipations are always from mind, those are not from body. So we have to treat the constipation of mind first, as our Dixit sir said. With the jata mamsi also the constipation will get cure. So in irritable bowel syndrome we found such type of cases in number of cases. Okay, so like this, some constipation are from mind, some constipation are from body, some constipation are from which we can say there is a difference in between the Avashtambha, Malavshtambha and Koshtabaddhata. So Avashtambha is the property of Purish. Avashtambha Purishasya, it is a karya of Purish. Imagine if there is no karya of Avashtambha of Purish, then what will happen? We have to keep a carry bag with us, or we have to walk with the diaper only, because there will be the no Avashtambha Purish Karya. Due to the Avashtambha Karya of Purish only, we are able to sit and we are able to evacuate our stool after 24 hours, because 24 hours it is Avashtambha, it is going to store over there. If it is more than 24 hours, then we are talking this is the Malla Avashtambha. Okay, now it is become a male. Imagine if your birthday cake you are eating, that cake some part will go to the as a nutrient to your body, that will form a prakrut dosha, prakrut dhatu and prakrut mala also, and some part of that cake will become a mala. So you cannot say like this now, no, this is my birthday cake and I will not eat that. That till it is your birthday cake, you have to make an outlet for him to go outside your body whenever it will become a mala of your body. So understand the dosh, dhatu and mala kalpana, and enjoy this what Avashtambha, Malavshtambha, and last one is Koshtabaddhata. So sometimes what happens in some patients, bowel movements are lethargic or slow, and bowel is not able to force the stool to go outside, and that is a Koshtabaddhata. So we have to think when we have to give the medicine to make a Prakrut Purisha Karya of Avashtambha, when we have to give the medicine for the Malavashtambha, and when we have to use the medicines for the Koshtabaddhata. Okay, in this short time of 30 minutes, I have tried to express my maximum views and maximum drugs over here. Whatever the mistakes happen are my, and whatever best I have delivered is of my guru and our acharyas and sanhitas. Okay, please forgive me. Thank you very much. Thank you for giving me chance to express over here.
Dr. Sachin.
Thank you, Dr. Harish. We have few questions.
Yeah, let us take.
Okay, thank you. So, Harish sir and Dixit sir, both of you have similar questions. Which drugs are safe in cardiological practice, that is post bypass or post angiography? Dixit sir, this is for you. So you will have to unmute your mic. Yeah.
As I told, usually Arogvat like Srausan medicines, they are useful, or medicines like Amalaki will be helpful, but depends on what kind of samprapti that patient was having, because in Katuka also they have mentioned as it is Rudya. It is beneficial for Hruday also. That means, so therefore depends on the samprapti. Sometimes Udavardhan and Gulma, that can result in Rudrok. Then different medicines will be required, but usually the medicines which will maintain bala of the person, like Amalaki or Aragvad or like that, they should be used, or Avipattikar, which are Mrudu variations. Those medicines should be usually used.
Again, the question is regarding pregnancy, but we had a session, full-length session on constipation in pregnancy yesterday. So that YouTube link will give all the answers regarding pregnancy, I think. There are many comments which congratulate both of you for your presentations and knowledge sharing. There are so many comments rather than questions in fact. Why do people pass stools twice or thrice in the morning hours only? This is again a question for you, sir.
Like I told, that usually that is related to indigestion. That digestion, because they had lunch, dinner late night, the food was not properly digested, and the person is trying to still defecate because the stools are not formed yet well. He is trying to defecate them, so that's why he passes the motions, then takes tea or something to stimulate again the bowels, and again passes the motion. So he's trying to defecate. Usually it is due to that reason in most of the patients, and in some cases that may be related to actually some abnormalities in of related to antra, like grahani in that, or in pravahika. That may be the beginning of that, and in that also, like that, people may pass the stools many times.
Okay. Harish sir, you have one question. Can Asav Arist be given to old patients before food for relieving Malavshtambh?
A very nice question. Yes, we can give, no problem, if the patient's Agni is good, and it will help to boost the Agni also. It is always better sometimes for Asavarishta, if you want the Agni Deepan Karya, then yes, you can give before food 10 to 15 minutes. So it will it will act like appetizer also, and it will work on the Apan Vayu also. So it will be the helpful for such mild laxative purpose also.
Okay. So there are many comments still coming congratulating both of you. On behalf of the association, I thank you both, and I invite Dr. Yunus Solanki for a vote of thanks.
Thank
Solanki,
you,
sir.
Dr. Sachin. Yeah, thank you, Dr. Sachin. I am audible. Yeah. Today we had very good speakers, both of them. Dr. Upendra Dixit, he has got a very good scholarly mind who could decipher the details of the meanings of the word described into the Samhita. You know, in our Samhita, there are some in-depth meanings hidden into Sanskrit texts. So only a scholarly mind, a well-studied clinician, can do that with hard work. And Dr. Upendra Dixit, I could find, is one such personality who could give a very good presentation on this small topic in this brief period. It was an excellent presentation. Same thing about Dr. Harish Patankar. It's always pleasure listening to him. His study of the Samhita and grip over the text and everything is really a pleasure. And thank God he did not chant that sutra more than 2 times. Otherwise, I too had an urge of visiting to toilet. Jokes apart, it was a brilliant presentation. Dr. Harish, you have given 2 different perspectives of text, the sutra, and Ekal Dravya Chikitsa, Ek Dravya Chikitsa. You have a scholarly mind. Keep it up, Dr. Harish Patankar. I think Dr. Sachin Patil, today we have got two scholarly stars on our horizon. And believe me, Dr. Harish and Dr. Upendra Dixit, we will keep on bothering you in future for such nice presentation. Thank you very much, both of you. I am thankful to organization for organizing such a beautiful series on one single topic of constipation. Ayurved Proctology Association will keep on thriving for betterment in future. Thank you all. Thank you, Dr. Sachin Patil.
Yes. So I conclude today's session. Tomorrow we will have again two speakers. One is Dr. Pradeep Sharma from Pune itself. He will be talking about surgical aspects of constipation. And second one is Dr. GHANASHYAM Kodwani from Nagpur. He will elaborate Nidanpanchak concepts of constipation, Malavshtambh. So with this, I conclude today's session. Thank you one and all. Thank you.
Thank you.
Thank you.
Thank you.
Thank you, Dr. Dixit. Thank you, Dr. Harish. See you later. Bye.